Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Here we're going to look at the cancer predisposition, cancer predisposition syndromes, and also the associated genes. So to begin with, we look at the ataxia telangiectasia. This is the gene involved is the ATM, and the chromosomes will be the 11q22 as well as the q23. 11q22 as well as 11q23. Next we move on to the Bloom syndrome. So what is meant by the Bloom syndrome? Bloom syndrome, the gene will be the BLM. BLM is Bloom syndrome. The chromosomes involved will be the 15q, and this is going to be 26-1. Now what is the Cowden syndrome? Cowden syndrome is going to be P10, and the chromosome will be the q10q23. Then comes the autoimmune lymphocytic lymphoproliferative syndrome. Lymphoproliferative, this is the syndrome. So this is going to be the FAS. This will be FASL, and the chromosome involved will be the 11q24. So it is 11q24 as well as a 1q23. 11q24 as well as 1q23. Next will be the FAP, that is a familial adenomatosis polyposis. So this includes the gene that is APC, and the chromosome will be the 5q21. Then we look at the familial melanoma. Familial melanoma is 1, and the gene involved will be the P16. The gene involved is P16 INK4, and what is the chromosome? Chromosome will be the 9p2. Then comes the familial Wilms tumor. So familial Wilms tumor. So familial Wilms tumor will be the WT1, and the chromosome here will be Wilms tumor will be 11p13. So it's 11p13. Then moving on to the hereditary breast and ovarian cancer, it is going to be the BRCA1 as well as 2, and this is associated with the 11q21 and the 13q12-3. Then we move on to the hereditary diffuse gastric ulcer. So this is associated with the CDH1. So the hereditary diffuse gastric ulcer is the CDH1, and also the chromosome will be the 16q22. Now the hereditary multiple exostosis. So this is the EXT1 and the EXT2. The chromosome involved will be the 8q24 and also the 8q24, then 11p1112. Then we move on to the hereditary prostate cancer. The hereditary prostate cancer, it involves the HPC1. So there's HPC1, the 1q2425, the hereditary retinoblastoma, that is the RB1, and this involves the 11q142. The hereditary non-polyposis colon cancer, we are writing it as HNPCC. So this it involves the MSH2, MLH1, MLH6, and PMS2. And the chromosome, it includes the 2p163, p21, and 32p16. So this is what is involved. Now looking at the hereditary papillary renal carcinoma, it is the MET, and also the 7p31. Then moving on to the juvenile polyposis. Juvenile polyposis. Juvenile polyposis, it involves the SMAD. This is the SMAD. SMAD, it includes the SMAD4. So it involves the SMAD4 as well as the 18q21. Then comes the Li-Fraumeni. There is something known as the Li-Fraumeni. Li-Fraumeni, it involves the TP53 and the 17p13. So the 17p13 and 1. Then multiple endocrine neoplasia, we are writing it as M type 1, MEN type 1. This involves the 11q13. Then when you move on to the MEN2, the MEN2A, this is again the RET. This involves the 10q, this involves the 10q, and this is 10q11 and 2. Now when you look at the neurofibromatosis, it has two varieties. One is by NF1, 2 is by NF2. One is by the 17q11 2. Now this 2 is by the 22q12 2. Now this nevoid basal cell carcinoma, and also known as the Garland syndrome. This involves a PTCH. So it involves a PTCH. Then also what chromosome is involved? The 9q. So 9q223 is what is involved. Then we move on to the tuberous sclerosis. Tuberous sclerosis, we have the TSC. So there's TSC1, TSC2. So TSC1 and TSC2. So chromosomes involved is 9q. So there is a 9q, 341 and P133. Then we move on to the von Hippel-Lindau's. Von Hippel-Lindau's, the gene which is involved is VHL, and the chromosome will be the 3P2526. To learn and grow daily like this, please do subscribe.